series of events that the patient is going through. Then the other benefit would be we will be reducing the cardiovascular and overall total mortality of the patient. I would like to share some fact with you people, that one of the major cause of death in whole world is cardiac events. Whether irrespective of the gender, if you talk about male or female, the one of the major effects of death due to diseases, the major contribution goes to cardiovascular events. So if you're just following cardiac rehab program, you are reducing not only the cardiovascular mortality rate, but you are reducing the overall mortality rate. Then you remember I talked to you about another goal, which was like we are going to just stop the recurrence or remittance of the cardiac disease. It will help you. It will help the patient with improving the myocardial perfusion. At the same time, it will help the patient to return to activities of daily living that are basically imposed or limited due to the disease. Now, coming toward the indications. I hope I'm not going fast. Actually, my focus is on how can I just complete all the aspects in due time. So if any one of you, if you want to just stop me at any point of time, you can. So talking about the indications, the first indication, I hope all of you will be familiar, and the most common and I will say the most underrated medical condition. People just think about a heart attack. In layman we used to say, हाँ वो तो बहुत common है, वो तो मतलब क्या उसको तो हर इंसान ये समझता है कि just very fine. आपने क्या करना है, एक nitroglycerin लेनी है and you have to place it sublingually and the patient will be all fine in few minutes. नहीं तो आप साथ में एक उसको antihypertensive कोई अच्छी सी दे दें. It is, I think this is the most non-professional and most underrated as well. How it is underrated? Because we just don't know about the implications of the drug we are given to the patient. So the indications, if you talk about the cardiac rehab, the first indication would be acute myocardial infarction. And I mentioned acute intentionally because being medical students, you will be aware there are three different, mainly we just categorize any disease according to their phases into three different phases: the acute phase, subacute phase, and chronic phase. There are certain diseases for them. जी, जरूर. जी बिल्कुल, I just agree with Dr. Nasir on this aspect. He's just right. That was what actually I was saying कि वो आपने सुनी होगी idiom, a little knowledge is very dangerous. आजकल तो हर कोई माशाल्लाह, फिर हमारी सोसाइटी भी ऐसी है कि हमें थोड़ा सा नॉलेज हो तो हम अपने आप को बहुत ज्यादा नॉलेजेबल बताना पसंद फरमाते हैं और फिर उसी की बेस पे मेल प्रैक्टिस स्टार्ट कर देते हैं. So the thing is, you should be if you are a physiotherapist, you should be proud of your profession and you should do whatever comes in your domain. Yes, you are able to prescribe the medicines in few domain globally. You are basically physiotherapists do that. Physiotherapists help and assist and evenly they perform. So the independent surgeries, yes, you can do that, but for that आपको अपना पहले basic knowledge strong करना होगा, ठीक है? So just that was one of the reason I was just talking about. Thank you for that. अच्छा, फिर हम बात कर रहे थे बच्चों. The first indication was acute myocardial infarction, and I was telling about the phases of diseases. So there are certain diseases in which we go beyond acute, subacute, and chronic phases. But mostly, if you talk about major division, we say that there are three on the basis of phases. We just categorize any disease into three basic phases. So the cardiac rehab is only and only, you can just note it down, you can just write it somewhere, you can just feed it in your brain. It is very important that cardiac rehab is only effective in acute phase. Acute phase का मतलब क्या होगा? I am rephrasing this thing in Urdu as well. Acute phase means आपको कोई कार्डियक इवेंट हुआ है, उसके 72 आवर्स के अंदर अंदर आप जो किसी पेशेंट को rehab provide करेंगे, that will be the cardiac rehab. It is the first indication of it, right? Then आपने देखा होगा, there are patients who undergo CABG. CABG is a very common term in our field of cardiac rehab, and CABG stands for basically coronary artery bypass grafting, जिसको हम लेमैन में कहते हैं दिल का बड़ा ऑपरेशन. आपने शायद ये बात सुनी होगी. So basically, the second indication would be CABG. What happens in CABG? I'm just going to give you a one-liner of it. I'm just not going to in the details, as we are running short of time. So basically, coronary artery bypass grafting is a procedure in which you just use a heart-lung machine. There are certain extractors. You just cut down the manubrium sterni and you just take out the heart, you perform the procedure. If there is any requirement that if any of the artery is occluded, then there are certain indication for CABG, that whether the patient is suffering from SVCAD, it is any single vessel coronary artery disease, or it is a DVCAD, that is double vessel, or it is a TVCAD, that is a triple vessel coronary artery disease. So it depends upon the pathophysiology of the cardiac disease, on the basis of which you decide that which kind of CABG surgery you are going to perform. Anyhow, the second indication would be your coronary artery bypass grafting patient. यहाँ पे एक चीज आएगी, when you talk about surgery, then there is a term, you must be familiar, you have at least heard about it, the pre-operative phase, the operative phase, and the post-operative phase. So cardiac rehab is not only effective in pre-operative phase, but it is effective in post-operative phase. Being a cardiopulmonary physical therapist, I would say in operative phase as well, because we are the ones who are extubating the patient, who are just weaning off the patient. And by weaning off, I mean to say we are the ones who are just putting the patient out. और अगर मैं मजीद इसको लेमैन में करूं तो किसी भी पेशेंट को वेंटिलेटर से हटाना सर्जरी के बाद, that's all what we do, right? So CABG. The third indication would be angioplasty. Now, here is a difference. Most people, I would say that they are just unfamiliar regarding this term. They are just confused. Maybe they are confusing this term with other things. There is another term that is angiography, as we talk about angioplasty. So plasty is the intervention. It's likewise we talk about ECG, graph and gram, right? Electrocardiograph and electrocardiogram. So likewise, angioplasty is the intervention and angiography is the diagnostic ones. So I am talking about angioplasty. I'm not talking about angiography, okay? So the third indication would be angioplasty. Now, whether you are doing the stenting in angioplasty or you are not doing the stenting, in both the cases, with or without, the third indication would be angioplasty. Then I hope you are familiar with the basic anatomy of heart. We used to say, and we always know this thing, that there are 4 chambers of heart and there are 4 valves. 2 of them are semilunar valve, 2 of them are AV valves. So all of these valves, whenever we talk about these valves, I just remember when I used to teach students the subject of physiology, I teach them one thing, that a disease named as murmur. If I hope any of my students can just recall that thing. So murmur is something that is a whoosh sound, and that is related with any kind of valve abnormality. Basically, it's the abnormality in the closure of valve. So that means that if there is any abnormality in the valve, then that abnormality can be cured. The other indication, or the fourth indication, would be valve replacements. So I hope it will not be new for you. We can replace the valves of heart. We can repair the valves of heart. Then again, there is a lot of detail in it, whether we are using a human tissue in valve replacement or valve repair, or whether we are using an artificial one. It all depends upon the other pathophysiology or the pathophysiology of the patient and other comorbidities of patient. The next indication would be heart transplantation. It is, I think it's not very uncommon. It's very common, and I hope every one of you will be familiar with this term. We are living in the era where we are doing the brain replacements, right? And I hope you all are being medical students, you will be familiar with this term as well. So heart transplantation, again, pre